Well, today is Sickle Cell Awareness Day. It's a genetic blood disorder that distorts red blood cells, causing chronic anemia and resulting in severe pain for some patients. Now, while this disorder disproportionately affects African Americans, experts say it does impact people of all races and ethnicities. Dr. Resa Caivano is from Kaiser Permanente Sickle Cell Center of Excellence in Inglewood, and Donte Cofield is a patient who's benefiting from a new form of treatment. They're here to talk about the need for more education about this disorder. Thank you all so much for being with us this morning.
Thank you for having us.
Thanks for having us.
Dr. Resa, I'm going to start with you. You're doing some really important work, but a lot of people don't know what sickle cell disease is. Tell us more about it and the new treatments for it.
Sure. So sickle cell is an inherited disease. It's genetic, and it requires two of the genes, so from one from each of the parents, in order to get it. And currently we have some medication, but there's also new gene therapy that's just come out that Donte actually has been able to receive, that actually is providing a cure for a disease that has a life expectancy of 20 years less than of regular life expectancy.
Absolutely. So this is a big deal that there's
it's
treatment for it.
Deal, yeah.
Donte, tell us a little bit about your story. How did you even find out that you had sickle cell? What did you feel like? What symptoms were you having?
I was diagnosed at birth because both my parents have the trait, which my wife ended up having the trait, so now my daughter has it too.
Wow.
It was a long journey.
Yeah.
A lot of expectations. I didn't expect to be here this long. Like you said, mortality rate was very unexpected.
It must have been so scary.
Yes, the pain was excruciating.
But you've been in treatment, you tell me, for a year now.
Yes,
and
I
it's
finished.
helping.
I finished.
Oh, great. Okay.
I am cured.
He's graduated.
Beautiful. Wow. That is amazing. I'm really happy to hear.
Yes.
And I know you were telling me your daughter's only 2 years old.
Yes,
and
she's
she
2.
has it as well.
And
so
she's
how's she
suffering
doing
right now? She's on the way out of a crisis. She's finishing. She's in pain, but she's getting better.
For people not familiar with this, what does it look like? What does she feel like? What is she experiencing?
I've explained it before as in been hit in the back with a hammer.
Wow.
Because it's like anytime your heart beats, you feel the pain and it throbs.
It just sounds something that's really excruciating and horrible for people to go through.
Yes, it is, and that's one of the things that is a struggle because people are in pain starting, at age 2 throughout their life, and they often get labeled as drug seeking because of the pain that they're in and the need for pain medication. So that's one of the things that we have to combat.
Yeah, and with everything expanded in these new treatment options, it's hard to hear your daughter understand is too young for this kind of treatment.
Yes.
So what do you do for a patient that young? Is there anything?
Well, currently it's IV fluids and pain medication.
Trying to keep her comfortable.
Yeah, there are some blood transfusions when you need it, which are really important. Blood transfusions are actually life-saving for folks with sickle cell.
I do want to talk more about that because you need a particular type of donor. So tell us more about the need for donors.
Yeah, so blood transfusions are not just sort of, oh, I have blood, I'm going to give it to someone else. You have to have a match. And if you don't have a match, then you can have really bad consequences from not having a match. And there is a shortage of blood donation in the Black community, and so therefore when folks from the Black community need blood, it can be difficult to find a match, and so there really is a need for increased donation, because in patients with sickle cell, sometimes they can need it just episodically, like once in a while, and there are some folks that need blood transfusions, exchange transfusions, which are 6 whole units of blood every month for the rest of their life.
Wow, I'm sure if more people knew that, they would be willing to step up. So should people just go to the hospital and say, hey, I'm willing to be a blood donor?
So the Red Cross is usually really good about accepting blood donation, and there's blood drives that happen often.
Yeah. I have friends that go to the blood banks, and Red Cross have the blood drives at like El Camino College and different places.
Absolutely. Well, I want to give you the last word. What do you want people to know who are experiencing this, who get diagnosed with this at a young age and feel like it's the end?
It's not. It's never the end. It's curable. I came out the other side. I've been on both ends. I didn't expect to make it this long. I'm 35. I have 3 kids. I'm excited. I'm happy. I feel amazing.
Absolutely.
Like gratitude. Like I'm grateful to my team, especially my care team at Kaiser Permanente. My sickle cell team is just amazing. I've used their education to educate other doctors on how to treat me and my kid.
Well, that's a beautiful thing to hear. Well, I hope your daughter feels better soon and can one day receive the treatment that has helped you. And Dr. Caivano, thanks for the important work you're doing.
Thanks for having us.
Appreciate you both for being here this morning.